Assalamu alaikum. Today we are discussing another pedicle here. So the gonadal vein, this is basically a left nephrectomy for a non-functioning kidney. We can see that we have dissected the gonadal vein. The renal vein is perfectly visible, and since there is no need to go medial to the gonadal vein, as it is not a malignant kidney, so we can dissect and deal with the pedicle lateral to the gonadal vein. That's why if we are going lateral to the gonadal vein, then we have to achieve some length of the renal vein so as to apply the clamps. Before applying clamps to the vein, we need to find the artery. The artery is not visible in its usual location, so we have to dissect behind the vein. So the beauty of 30-degree telescope is this thing that you can rotate and manipulate your vision so much so that you can even see behind the renal vein. So here we are trying to find the artery. With the suction dissection, it is better because a little bit of bleed coming, that can be cleared. Here you can see if we go medial to the gonadal vein, we'll be able to find the artery. But another important thing is the lumbar vein here. This one, yes. So if we clamp the gonadal vein, then we have to clamp the lumbar vein as well. So we are trying to avoid ligating all those veins. We are lucky to find and see the renal artery behind the renal vein, but it is along the superior border of the renal vein. However, we can deal it from below. We will just apply a clamp, a hemolock clip, and then we will deal with the vein, and then we can deal with the rest of the arteries. It is the basics of laparoscopy. However, we can modify the procedure according to the need, and we can adjust our procedures. But whenever there is some problem, just go to the basics, the ABC. And the ABC is to apply a clip on the artery, and then deal with the vein, and then deal with the rest of the artery. So now the right angle to dissect the renal vein, and as I mentioned earlier, we need to achieve a little bit of length on the renal vein towards the kidney, so that we can apply two clips towards the major vessel and one clip towards the kidney. I think the length is now enough, and now you can see that we have avoided clipping and cutting of the gonadal vein, and yet we are able to clip the renal vein. So after applying the clips, we are cutting the renal vein in fractions and towards the clip which is towards the kidney. So nice and safe. And now the artery is visible, so we will apply a clip proximally and another clip distally, and then we will cut in between. Thank you very much, and don't forget to subscribe to the channel and forward it. Thank you.